The following video shows an example of how a complete CPR rescue might play out with a 3-member lifeguard team. In this example, the lifeguards show up one at a time. It focuses on the roles of each lifeguard. It is critical for each lifeguard to master each role. Other scenarios may involve all 3 lifeguards showing up at the same time. A well-choreographed rescue team usually leads to better patient outcome. And lifeguards still need to be able to adapt to changing circumstances. All rescues begin with a scene assessment to ensure the area is safe and to gather some history. Check the patient's level of consciousness. Check their breathing for 5 seconds. Call for help. The clerk will make contact with EMS. Begin CPR as soon as possible. Compression rate is 120 compressions in a minute. Use your safety pouch shield until the positive pressure mask arrives. Insert and use this shield properly. The second lifeguard arriving takes over compressions. Both lifeguards are now doing 2 rescuer CPR with 1 ventilating and 1 compressing. Important information is also passed on at this time. When the third lifeguard arrives, important information is exchanged and the AED is passed to the second lifeguard.
Unit OK. Stay calm. Check responsiveness. Call for help. Stay calm. Check responsiveness. Call for help. Open airway.
A blanket is applied up to the patient's waist.
Check breathing. Give 2 breaths. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing.
Follow the audible prompts from the AED.
Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
If there is no change in the patient's condition, continue with CPR. Guard 3 now sets up the oxygen equipment. Open the main valve full open and then a half turn back. Set your flow dial to the appropriate rate. Attach the non-kink tubing to the regulator. Attach this tubing to the oxygen adapter. Ensure there is oxygen flow. Guard 3 begins the report.
Don't touch patient. Analyzing.
Follow the audio prompts from the AED every 2 minutes.
Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button.
Move the oxygen equipment away from the patient prior to shocking.
Touch patient. Press flashing shock button. Shock delivered. Start CPR.
Guards 1 and 2 will switch positions and continue CPR if there is no change in the patient's condition. Guards 1 and 2 also exchange mask valves at this time to prevent cross-contamination. The lifeguard uses the Cephalic technique to open the airway and ventilate the patient. Ensure a good seal. Change the oxygen bottle when the gauge shows 200 psi or less, or it's in the red. Turn off your main valve, remove the regulator, leave your flow dial settings in place. Inspect the new bottle. Remove the dust cap assembly and the tag. When cracking the new bottle, ensure it's facing away from everyone. Reassemble the regulator to the bottle. Open the main valve with the gauge facing away. Continue CPR until there is a change in the patient's condition or you are relieved by EMS personnel. Pediatric AED pads are placed on the anterior or front and posterior or back of the child or infant patient.
Unit OK. Stay calm. Check responsiveness. Call for help. Stay calm. Check responsiveness. Call for help. Open airway.
The pediatric pads replace the adult pads on the AED unit.
Check breathing. Give 2 breaths. Attach defib pads to patient's bare chest. Attach defib pads to patient's bare chest.
Once attached, follow the audio prompts from the AED. The following shows how an actual field unit AED operates in the field. There are some differences between it and the training unit.
Unit OK. Adult pads. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Unit OK. Pediatric pads. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
The following video shows how a lifeguard would use a positive pressure mask assembly when working from a patient's side. It is done in a similar manner when working on all age groups.